Welcome to the Beauty Talk with Dr. Daniela Greiner-Krüger. We will be talking about the JUVÉDERM facial fillers and what they can do for our facial appearance. And there's lots more that we can experience with facial fillers, as we know right now. JUVÉDERM is one of the world's leading brands when it comes to facial fillers. So I'm very happy to be here with Dr. Greiner. Thank you very much for inviting us to your clinic.
Thank you. It's a pleasure for me.
Welcome to this talk, and I'm happy to be here in your practice, and thank you. How long are you in the field? How long are you operating, or how long are you working with fillers?
Thank you very much for the introduction. Yeah, my name is Dr. Daniela Greiner-Krüger, and I'm a board-certified dermatologist, and I have been here in Oberursel, this is in the northern part of Frankfurt, since 2001.
Okay.
And that's when I started my clinical practice here. Okay. Before that, I trained in a university hospital, in the Frankfurt University Hospital, and I stayed for 2 years at the Duke University in North Carolina. Okay. So I'm trained in classical dermatology, and when I started my practice here, I started to do a lot of aesthetic dermatology. Okay. So since that time, I really opened my eyes to the field of botulinum toxin and to hyaluronic acid fillers.
Okay. How long have you been working with fillers? How long have you been working in the field, as we can say?
Well, I started in 2001, so actually I have been working with fillers now for over 20 years. Okay. So I saw really a big array of fillers coming and going. It started out with the collagen fillers, and we had several other fillers coming, but the JUVÉDERM brand and the JUVÉDERM whole choice of the different fillers really made a big difference for me. Okay. And so it's really one of my favorite fillers from the hyaluronic acid fillers, and I think they really deliver great results.
I think times has changed very much when it comes to fillers and the possibilities that come with that. So can you give us any number about how many injections you have been given in the last years?
Approximately. Looking back, yeah. I think it must be over 10,000 of injections. I think I do more than 2,000 a year. So okay. Just counting back, it comes all together to a lot.
A lot of practice and a lot of, yeah. Do you specialize on anything, or is something special when it comes to fillers?
Yeah, I think I really specialize in the field of the whole face approach, the full face approach. So that's really one of my main interests, to give the patient a balance of the face back, to look for proportions, for symmetry in the face. Okay. And as I'm a trained dermatologist, I also would like to combine it with treatments for the superficial skin, for redness or hyperpigmentation, so blemishes. Yeah. So for me, it's one thing altogether, and I really like to combine it. Okay. To get the best results for my patients.
So also glow and everything that makes looking skin younger and healthier.
Yeah.
Maybe we start from the beginning. What exactly are fillers?
Yeah. What are fillers?
Yes.
Yeah. So one of the big brand of fillers are the hyaluronic acid fillers. And the hyaluronic acid is a substance that's also in our body. It's originated in our body. We have it in our connective tissue, and we have it in our joints. And this hyaluronic acid can be produced in bacterial cultures. Okay. And there we have long chains and short chains of hyaluronic acids, and they are put together in a special ratio into a mix. And that's how you develop different kinds of fillers. Yeah? So you have fillers with a very high lifting capacity, and then you also have fillers which are very soft and which are more for the surface. Okay. And these can induce a beautiful glow in the skin, and they can make it smooth and a really nice appearance.
So we have a real big range of fillers that are very different in their approaches. Yeah. How long have they been on the market? Because you just told us that you started in 2001. So have there already been fillers on the market for that long term, 20 years?
In 2001, actually, the JUVÉDERM fillers were launched. Yeah. Okay. So this was I think at the beginning of 2000. This was really the age of the hyaluronic acid-based fillers. Before that, we had collagen fillers, but they really were problematic as they could induce allergic reaction, and we had to do a lot of testing. And due to the BSE problematic, it was kind of obsolete at one point, and we left that kind of fillers. And now our main fillers are the hyaluronic acid fillers.
Okay, but how many treatments may be carried out? I mean, it's hard to know maybe the exact numbers, but a year, and how do they work?
Yeah, so that's really hard to get numbers about that.
Yeah.
So looking at the whole Germany, I think we've got numbers like around 400,000, but this, I think it's much too low. I think there's a big number which is not reported. So I think we at least have 500,000 or probably 1 million treatments of hyaluronic acid fillers. I don't know.
Also a very important question maybe for our spectators. And you can ask your questions, please, in the chat, and then we will answer them later. If you have any questions or comments, please put them in the chat. Maybe we start like, what is the difference between botulinum toxins and hyaluronic acid? Some people don't know about that.
Yeah, that's always striking me.
Yeah.
If you work in both substances, botulinum toxin and the fillers, can work in the anti-aging field. Yeah, it's just a complete different mechanism how they work. Botulinum toxin, for example, is a relaxant of the muscle, so you can use it for mimic muscles. Okay. So you can reduce the mimic if you are frowning, if you are smiling, or if you have like a concentrated glance. This is what you can influence. With the hyaluronic acid filler, on the other hand, you can really lift up the skin. You can give volume to areas where you've lost tissue, or you can give, you can put it in more in the superficial skin, where you can give a glow to the skin. So there are like different areas where you can put the hyaluronic acid. So both work good together. Yeah. So if you have something like a full face approach, we're using the botulinum toxin to decrease mimic wrinkles, and we also use the fillers to build the whole face up and to give it something back where it's starting to lose tissue contraction firmness.
Okay, so it is also like a part of the treatment that you can combine both of them, and the aging will be more gracefully in the face, right?
Yes.
Okay. So why fillers? Because there's lots of people who have prejudices when it comes to fillers, because maybe sometimes we look at some people who have been like over-corrected or whatever. We think of duck lips or these very bad examples. That is. Can that happen, and how often does it happen, and why does it happen when it happens?
That's a really good question. Yeah, we actually have a new wording for that. It's called overfill syndrome. Okay. Where we have too much fillers in the face. I think it's a question. Actually, you should not be afraid of that, because if you have a good doctor and who gives you a good consultation, good advice, you're not at risk at looking like that. And if you're using good products like the JUVÉDERM fillers, also, if you go to someone who's really trained in fillers, he will always advise you for more of a natural look, and he will not over-treat you in special areas. But still, there are, especially some of the younger customers, they like to overdo. They like to show big lips. They like to show
cheeks, maybe higher
cheeks, high cheeks, and so you know, it's life. There's room for everybody.
Absolutely, and
you can go one way.
To the personality, when it comes down there. But I think therefore it's really very important that you address to someone like you, who is really in the field, who is like a doctor, and not go, because I sometimes see some advertisements, for example, that you can have fillers here and there at places where we should not go, because it's not also like very important to use the right fillers like JUVÉDERM, but also the expertise that is behind it, right?
And this is a big field, the expertise, because you need a special anatomical training, because only with knowing your anatomy, you can really make sure that you don't, that you always treat on a safe area, and that you have, that you don't have any side effects. And then the next training is also that you have to evaluate this, the face, and you have to see the face as its whole. You need something like a holistic approach, and then you have to, then you can give the patient a good advice what could be treated. And you also could make like a hit list. Yeah, you can say like this area is more important for you than other areas.
Yeah.
So it's really important that you have a good consultation and that you feel safe at that consultation.
So sometimes the patient is concentrating on a part of the face that is maybe not the problem, to put it that way, and you can give the advice to do something different that makes the whole impression perfect or look younger or more harmonic, right?
Yeah, that's the point is like we are trained in reading faces. Yeah, so we do that every day. Yeah,
Okay.
we look at the faces. So if someone comes to us, they recognize that something is not okay in the face or is wrong, but they can't really point it out.
What it is,
so.
yes.
What they read in the newspaper is like you can treat glabellar lines, you can treat the barcode lines around the mouth or something like that. So people, the patient come and they say, oh, I want to have glabellar lines treated. And I look at the face and say, well, you need everything else but not the glabellar.
But I insist.
Well, if the patient insists, I definitely treat the glabellar.
But I think that is very important, because as a patient you don't know. You might think that is the point that you have to
and this is lesson
address the
learned.
doctor.
That's true, and that's lesson learned for me. I always treat what the patient is asking. So if someone asked me to treat glabellar lines, I would always treat glabellar lines, but I would offer him that there's more to do for him.
Okay.
I would at least offer it to him. Yeah. So what we or what Allergan developed is this kind of a chart with the emotions, with emotional attributes, which helps us doctors to find out what's the demand or what's the desire of the patient, and I can show you that. Yeah, it's like we have it here on the chart. So we have like 4 negative attributes and we have 4 positive attributes. And we always start with the negative ones because we want to clean up the house. We want to do that first. So so the negative attributes are like you want to look less tired, or you want to look less saggy, or you want to look less sad, or you want to look less angry. If someone comes out and he points out to one of those emotional attributes, like I want to look less tired, from a minute I know tiredness is somehow related to your eyes, and a little bit to the mouth. So it trains me as a doctor that I know which areas of concern, and then I can have a better look in that area and define what has changed over the years, and then I know how to treat. Yeah. So that's pretty helpful.
Because I think a lot of people, they don't even know where it comes from, the feeling that they look too sad or too bad or anyway, angry. So I think that's very, very important. Is there any age that we should consider when it comes to fillers? Is there any like too young or too old? What would you recommend to people?
Yeah. First of all, we don't treat minors. So no one under 18. Yeah, they have to be at least they have to grow up. Otherwise, it's really up to the patient. Yeah, I would not put it at a definite age. Yeah, so you should not start with prior to that age, or it depends because everybody is different. Someone has more action in the face and more mimic. The other one really has a good skin and they don't have to do anything till they get 50. Yeah, and others, they sit in front of me and say, "Oh, look at me! I've got so bad glabellar lines now at the age of 25." Yeah, so. But overall, you can say that you start the treatment with the botulinum toxin a little bit earlier, because here you treat mimic wrinkles, and with the botulinum toxin you can minimize this muscle activity, so you can prevent that. And with the hyaluronic acid fillers, you can start a little bit later when you see really deficiencies in the face. But there's always a but. And but comes now. Even with younger people, younger ages, it could be that there's a disproportion in the face. So someone has some problems with the chin, or it's the jawline, which is not defined, or even the lips. So there's no never.
Okay, so it depends very much on the person, and we all age differently, so there is no real age that we can refer to.
Yes.
Okay, we have been talking about the emotions which patients have when they come to you, or the expectations maybe, but please let's talk again about the fillers themselves, Juvederm fillers. What can they do for our face and how do they work?
Yeah, that's a really interesting question and a good question. So, as they are hyaluronic acid fillers, so what's happens if the filler is injected into the skin, it has a really big water binding capacity. So first of all, it's nourishing your skin and it's giving you like a glow. Yes, it's smoothing your skin. If it has been put in like more the upper layers of the skin, but you can also use it for volume restoration. For example, if you apply the filler in deeper areas, like on the bone, below the muscle, yeah, and then it's giving you like a firmness, and it's also inducing new collagen stimulation. Okay. So if you look carefully at the face and you find areas where you see that a little bit of tissue is diminishing, yeah, you can put the filler in that area, and it's like restoring the skin again. Yeah, so we can restore, we can give volume, and we can give a glow.
Okay, so it can also like support the own collagen. Yeah, how do we say, like when it comes to the where they're sleeping back the collagen, so that it's a little push for producing it by itself. So we can also like postpone a little bit the aging of the face and
That's right. With a hyaluronic acid, it's stimulating the collagen, so we have new collagen developing, and with that, consequent. So faces really develop differently. They develop differently because we don't have the mimic stress. Because we have less motion in the skin, and that's why we really have a complete different aging with that.
So it's making sense from time to time to refresh the fillers so that they can like really work in your face and build it up again.
Yeah, I think it's really more natural. You know, if you give something back to the skin, well, what the skin has been losing over time, and you give it back, and then it's really restoring again. A lot of people are talking to me about how long it lasts, and this depends on the filler which I'm injecting. I've got fillers which last for about 6 months, and I've got fillers which last for about 24 months.
Okay,
so it's really different from the filler itself and from the content of hyaluronic acid in the filler, and that's. But this is really, it gives you overall, it gives you a much nicer impression if you work with different fillers in different areas.
Yeah, they're supposed to be treated, or the different areas have to be treated with different Juvederm fillers. We will talk about that too. But which parts of the face can be treated? I think there's lots more possibilities than we can imagine right now.
Yeah, let me explain that to you. I brought something with me. It's like the portfolio of the whole Juvederm fillers.
Yeah.
And if you look at that, so in the JUVÉDERM range, we've got, we start out with Volite. Volite is our softest filler. It has 12.5 milligram hyaluronic acid per ml. So we can use this for hydration, we can use it in the upper lip, we can use it on the cheeks or on the forehead, and just to give the skin back some moisturizing, some glow, some nourishment. And then we have the Volbella. Volbella has 50 milligrams hyaluronic acid per ml, and Volbella is the ideal filler for the lip. Yeah, if you start out with the lip, it just gives you also a little bit of hydration, a little bit glow, and it's also a nice filler for under the eyes, to treat the tear trough area. Then we have our all-rounder coming. It's called Volift, and the Volift has 17.5 milligrams hyaluronic acid per ml, and this can be used for nasolabial folds. It can be used on the cheeks, on the chin, and also on the areas where there's a lot of motion. Yeah, like if I'm talking, you see that there's a lot of motion going on around my mouth. Yeah, so Volift would be something to smooth that out. And then we have our two fillers which are giving volume. That's Voluma with 20 milligrams per ml, and that's Volux with 25 milligrams per ml. So the Voluma filler we like to use if we want to give like a cheekbone enhancement. That's really great for that. And the Volux is great for the chin, for the jawline, and to give a good definition. But not everybody, this is a good filler. The Volux is a perfect filler for male patients because they have more heavy skin. And some of the female patients coming from Russia or coming from
India, for example.
Yeah, they've got from India. They've got so heavy skin, and so we need something that's really lifting up. But we also have this very tiny woman with a more of a soft skin, where I usually like to take the Voluma and the Volift. I'm better with that. Yeah.
Okay.
So you need a little bit experience, and you have to know where to use which filler, because you don't want to have the Volux in the superficial skin for hydration. That would be not, or in the lip.
So a little experience is very does not fit it. So you need a lot experience, and so therefore, please address to someone who is really like a doctor who knows the aesthetic of the face and where to put which kind of JUVÉDERM fillers. Okay. Is there any current trend right now that people come to you and say, like, patients, I want this, like XY, or I want to look like Angelina Jolie or whoever it is? Is there any particularly popular zones that are being treated right now?
Yeah, this is very dependent on the social media, as you can imagine. Yeah, whatever the next trend on Instagram.
And it changes quickly, I think.
Yeah.
Yes.
But what's a trend at the moment is the jawline. Jawline definition. Everybody likes to have a nice cut jawline. Chin, projection, chin is also in the middle of interest. And I think it's a little bit more popular than lips. Lips were like the starting truck at the beginning, so everybody wanted to have a lip treatment.
For beginners?
For beginners, yeah. Because you can have a lip treatment for, let's say, small pocket money, because with only a small amount of material, you can achieve a lot of result at the lips. So lips used to be very popular, but I think now the jawline is coming.
So let's talk about again about the experience. When I come as a patient to your practice, how does it work? What kind of questions are you going to ask me?
Yeah, first of all, we have a consultation where I just ask for the desire for the patient, what the patient wants, what's the reason why he's visiting me. Could be that someone out of his friend area said like he looked a little bit sad, or he looked a little bit tired, or he was sitting in the Zoom meeting and said, oh, I can't look at myself anymore. I have to go somewhere. They're like,
I have to get some chocolate.
Yes,
I'll be back.
There are really so different motivations for that. Yeah, and I try to find to get like a little feeling for what the patient wants. Then I give him a mirror and tell him, now show you what you see. Yeah, what's really bothering you?
Yes,
yeah, and then they show me the glabella line or the barcode lines or something with nasolabial fold. And then I put this together, what he's complaining about and his emotion, and then I do like a facial analysis, and then we usually set up like a treatment plan, yeah? And we don't have to do everything at once, yeah? It's really better. It's also better from the skin, as we explained before.
Start slowly.
Yeah, start slowly, and because of the hyaluronic acid is really working in your tissue. It's building up collagen. You don't have to do everything at once, yeah?
Yes.
So we have set up like a treatment plan over several months or a year or 2 years' time. And what we always do is we take befores and afters. Yeah, so we take pictures. I said you only have one chance to take the first picture.
Exactly.
That's when the patient comes in the first time.
Like the first impression. Yeah.
And it's always nice to compare later back to the first visit. Yeah, and so we have a special room where we just take the photographies from the different sides, from the frontal, oblique, and side view, and so we have a nice comparison for the future.
So every treatment is absolutely personalized for the patient, right? There is
Yeah.
no standard procedure that we do and that's it and go home.
Yes,
So I think that's why it's so important to use the right fillers like JUVÉDERM and to have the praxis and also the experience that you have. There's some people who are a little bit afraid of needles or so. Does it hurt? Is it really painful? Or?
I think it's a little bit stinging, yeah, to be correct in that, and to be honest in that respect. But what we can do is we can apply some numbing cream, some local anesthetic cream, which we usually apply like 15 or 30 minutes prior to the treatment, and this usually takes care of everything. What we also really like to do during the treatment is like we've got cool packages, so we put some icing on the skin, so you really nearly feel nothing.
You hardly feel anything.
And another advantage is that you have lidocaine in the JUVÉDERM fillers. So only the first peak can be a little bit discomforting, but then you don't feel anything.
Okay. I mean, we can stand a little bit for the beauty, right?
I think that's really durable.
It's worth it. Are there any patients or kind of patients where you strictly not recommend fillers, or where you say like you should do something else? What kind of people are those?
I think we should not treat minors. So below the age of 18, we should not treat anyone. They have to grow up first, and then we can decide that.
Maybe also people with too many excess of skin.
Yes, and then we have this category where people just haven't done anything for like many years, and they come with really deep wrinkles and with like lax skin, a lot of skin laxity and loose skin. And then I think those patients are really hard. You really have to make it clear to them that they need a lot of filler. Or that sometimes it's even better if they do a facelift first. And then, but it's again, it's about expectation and what you want to achieve and where you want to go.
What is the goal? Is like a big change or a bigger change or so? But after, because you said facelift first, does it make sense to use fillers after facelift to remain the beauty of the face? Yeah,
it's a very popular combination, and I think nowadays no facelift is done without a filler treatment afterwards. Because what you do with facelift is you tighten the skin. So the skin so the face gets more sharp. And with the fillers you can give the face back the curvature, more rounding. So it's a very nice look if you use a little bit of fillers.
To make it softer and nicer, even more even looking. Is the result like to be seen at the moment where you put it in, or do we have to wait a little?
That's the great thing about hyaluronic acid. You can see it immediately. You treat the patient.
You're very impatient, women especially. So you want to see it right now, yes.
You see an immediate result, and it's even getting better after 2 to 4 weeks. I think the maximum result, due to the water intake of the hyaluronic acid filler, you get the best result after 2 to 4 weeks. It's also when the bruises have gone. I mean, if you have a bruise, it usually takes about 1 to 2 weeks to disappear, and then you have a really nice glow.
And then you can see the great results. So we have been talking about that the results like last between 6 months and 24 months. So it depends on the JUVÉDERM filler that you're using for which area. And but it does make sense then to come back and to do it again, or to repeat the fillers.
That's what I have. I have a lot of patients under like on a regular routine, and then we just check the face and we look for deficiencies, So I say, did you recognize something? Did you recognize something around your eyes, around your mouth? But usually they come back and say, you have to. It's your decision. You have to look at it.
You're the boss.
You're the boss. You should take
expertise.
Expertise.
But I think that's a very important point, because you can really figure out what has to be done. Maybe a little bit more or less, because as a patient you have your wishes that are clear, but you don't know how to achieve it. So
that's it.
I have to go to someone who knows that.
Right. And the doctor has the expertise, and he has also the capability of treating. He knows what he can treat and where he can treat, and a good doctor should also have in his mind what he can achieve. Then he can really give his patient a good consultation.
Is there anything that I have to take care of after the procedure? What you would recommend not to do or to do?
There's something I would really not recommend to do, and that's sleeping on your belly.
With your face in your pillow. It could be hard breathing also, but
Some people are belly sleepers. not very much, but
not
this
for
is
the first 2 nights,
that should not be done.
Face up,
And so the other thing is, I really discourage people to do something that's inducing a lot of blood flow in the face. This is like sauna, that's like excessive sport, like going into the sun, or into, like in winter time now, going out when it's very cold outside. Everything that's inducing a lot of blood flow in the face. I would be careful careful with that for about 1 or 2 days, or a week time,
Can a normal person, like with a normal income, afford the treatment? Is it very expensive?
For sure he can afford it. I think the treatment costs start with about 200 euros. That's for about like one hyaluronic acid treatment. But then it depends. It depends a little bit what you want, what's your goal is, what you want to have. If you just need a little bit of changes, if you want to have more, and the more material you need, the more expensive it gets. But the patient is always
step by step,
you can do it. But the patient is always the boss, and we go with the pocket of the patient, and we go with the desire and the wishes of the patient.
But after because I really would like to emphasize that it is so important to go someone like you, Dr. Greiner, who has the experience, who knows the anatomic of the face. And also at this point, I would like to cordially invite you, if you have questions, please write us with the chat and we will answer your questions later. Dr. Greiner, how do I find the right doctor for me? How do I know who is good for me?
Yeah, that's really an important point, and I like to encourage everybody to go on a web page. It's called www, and it's JUVÉDERM.de, and there you have a doc finder for JUVÉDERM, and you can look in that doc finder. You always find doctors in the vicinity of your home, and those doctors are specialized in using JUVÉDERM, and they are trained in using JUVÉDERM. They know their anatomy, and they know how to develop treatment plans, and they know how to evaluate a face, and so give the patient back the best results.
So they are approved doctors which are trained with the JUVÉDERM fillers, and we know how important that is, the different areas, the different type of fillers that are being used. Thank you very much, Dr. Greiner. We have a patient here, so you will show some examples what we can do, and I think that's going to be very, very interesting. Again, if you have questions, please ask us via chat, because all the questions will be answered later. And thank you for the nice interview.
Thank you so much, Ms. Navarre. It was a pleasure.
It was my pleasure too.
So now we heard so much about JUVÉDERM fillers and how they work and the different JUVÉDERM fillers we have. But let's go to the patient. Let's see how we perform the patient consultation. And I have a very nice patient with me today, where we're just going to do our first patient consultation, and we really do it step by step. So I'm going to show you how I do it really in my practice. So first of all, I'm going to take a mirror, and I give the mirror to the patient, and I just ask the patient what's her main concern and what was the reason why she came to me. So what did you recognize in your face? Or what is bothering you?
Ja, also ich sehe in meinem Gesicht natürlich schon, dass es gealtert ist und dass ich schon einige Falten habe und die gerne ein bisschen verfeinern würde, dass ich etwas jünger aussehe, vielleicht doch nicht mehr ganz so müde und ja, wie gesagt, ein bisschen frischer.
Okay. So what she was explaining to me is that she recognized that she's missing freshness in her face, that she looks a little bit tired, and that her face does not really resemble her age, what she's feeling. She thinks she looks a little bit older in her face as she really feels. So I'm going to try to specify that in asking her what area of the face she's more concerned about. Welcher Bereich des Gesichtes fällt Ihnen denn da besonders auf?
Ja, ich denke, der Kinnbereich um den Mund herum ist sicher am auffälligsten.
Okay, so now she said that what's concerning her most is the perioral area. She recognized that she got a little bit more wrinkles in the perioral area than in the other areas. So that's really a good starting point for the two of us. So we know we have to do something against the tiredness and something to improve her perioral area. But let's find out what her motivation is behind that. For that, I've got this chart. On the chart, we are seeing several emotions. We've got negative emotions and we've got positive emotions. So if you look at the negative side, we've got less tired, less sad, less angry, or if you have sagging of less saggy. The other four emotions, it's like younger, more attractive, contoured, or more female, feminine. These are the more difficult ones to treat. So now let's let her choose. Yeah, so I give her the chart and let's see what she's picking up for herself, what she wants to improve.
Also ich würde als erstes sagen, ein bisschen weniger müde aussehen.
Okay, she first pointed out less tired. Okay.
Weniger schlaff hängend.
Less saggy.
Und ein bisschen jünger aussehen wäre auch ein Wunsch.
And for sure she wants to look more younger. So if we think of that, pointing out less tired means there's something around the eyes. Something is inducing tiredness in the eyes. And if she says a little bit sagging is usually around her mouth. It's a combination. The mouth is really a combination between activity of the muscle, because with your mouth we are speaking, we are eating, we are doing so much motion with our mouth. That's why we have a lot of wrinkles around the mouth. And we also, in the perioral area, we also experience the sagging of the skin, yeah? Because that's what's coming here. If we have a loosening of tissue here, it comes down and we recognize it downwards. So now we know that she's concerned about the tiredness and the sagginess, but let's go into deep. So we're going to do the next step, and to that next step I'm going to give her the mirror back, and I have something else. This is the mirror, so she can have a look at herself, and then I use this device to put back her hairs. It's like a hairband. This is really important, to put back the hairs, because with putting back the hairs, you can see the whole contour of the face. The hairs are usually a little bit distracting, so it's good just to get them out of sight. So now we're starting to analyze the face. We are doing that in 3/3. We are starting with the upper third, and this is starting right below your hairline, and it goes down to the eyebrows. Then we have the mid-third from down the eyebrows to the lower part of the nose, and the lowest third is starting at the bottom of the nose to the chin area. These are our thirds. And now we just try to make it a little bit more easier. So we ask the patient, what's your best and what's your worst third? What do you think?
Also ich denke, dass die Stirn bei mir noch der beste Teil ist, dann der mittlere Teil auch in der Mitte liegt und hier unten halt die Hauptproblematik, der vielleicht Teil, wo am meisten gemacht werden könnte.
Okay, so let's have a close look. And I agree completely with her. I came to the same opinion. I think her upper third is really the best, yeah, because she has only minor lines. There's not, the skin quality is nice. I see a quite good shape of the eyebrows. And if I'm palpating here, they are right in the right position. They have moved too much downwards. We have a little bit of wrinkle in the glabellar area, but that's not a lot. The only thing is that I see a little bit of indentation here in the temple area. So the next thing is the mid area, the mid-third, starting below the eyebrows to the tip of the nose. If we look at that third, it has a good structure. Yeah, we really have to say it has a really good structure. So the mid-third is better evaluated if we bend the head a little bit downwards. Yeah, so we bend this downwards. So what are we seeing now? We see a slight movement of the fat tissue, the fat component to the front, and now we see the development of a tear trough here, of sagginess around the eyes, and we also see that there's a loss of fat tissue in the cheek area, in the frontal and in the dorsal cheek area. We have a loss of fat tissue, and this loss here is is the reason why the skin is sagging. I can show you here, if we give a little bit of elevation here in the mid part of the face, we have an improvement of the sagginess. So looking at this mid third of the face, we can consider treatment of her cheek area and of the dorsal part of the cheek, of the cheekbone area and the dorsal part of the cheeks. And she would also profit from a treatment of the temporal area, because this would give stability to her eyebrows and it would just open her eyes. Only treating her cheekbones would show that you get open eyes, that you get a relaxation of the eyes. At the moment, as we have a loss of fat tissue here, everything is pulling down, and this is putting stress on the eyes. So we need some volume here in the cheeks, and we also need some support in the dorsal part of the cheeks. Now coming to the lower part of the face. Yeah. Looking at the lower part of the face, I'm going to let the patient smile. Okay. Now everybody can make a decision if you think if she looks better, if she's smiling or not. I think there's no question about that. It's a winner. She looks much better. If a patient is improving when you're smiling, this means that you have to lift up the cheeks and you have to elongate the chin, and you have to treat these areas in the chin area. One thing we haven't done so far, we haven't looked at the lateral view. We also have to look at the lateral view of the face. So looking at the lateral view of the face, we have an imaginary line. It's called the Frankfurter horizontal line, and it starts at the outer root of the ear. It crosses the lower border of the infraorbital rim, and this is our horizontal line. And over that line, we are putting a vertical line coming directly from the nasal base vertically down, and then we are looking at the chin, if the chin hits this line or not. If the perfect position of the chin would be right hitting this line, so we see there's a slight recessed chin. So she would also improve from some stabilization here in the chin area, and for sure, we have to do something in her marionette line. Her chin and her sagginess is improving if we treat here. That's true. But we're going to have much more improvement if we treat the marionette area and the submental area. Now, just do me one last favor. Just give me a kiss. So, and if you see the kiss, you see all the action of the muscle orbicularis oris, and you see there's a lot of strength here and here, and that's what we have to treat with hyaluronic acid. Wherever we have a lot of muscle movement, we need some support of hyaluronic acid, as I explained before, because we are losing tissue, and we have to restructure and rebuild that. So it was a pleasure to do this kind of evaluation. I'm going to write down everything on a chart now, which I'm going to show you. And this is called my so-called treatment plan. Yeah, I can mark here what her emotional motivation was. I am going to put here the main area to treat, like the temporal area, like the cheekbone area, and I want to treat the slightly recessed chin, and I want to stabilize the chin. These would be my main treatment areas. And then I'm going to go over to a treatment concept. I'm going to put down a plan for her, and we're going to decide what treatment we're going to do in individual steps up to her speed. We can treat every 4 months, we can treat every 6 months, we can treat once a year. It's depending on her budget, and it's depending on her time and what she wants to achieve. Thank you so much. And we would like to say bye-bye and thank you to our patient, and I would like to mark some closing remarks outside. Thank you so much.
Thank you.
So there was a lot of information which we got from our discussion and now with the patient consultation, and probably there is some questions left. So we are opening the chat now. But before that, I really would like to thank you, and I can only tell you, if you are interested in street treatments like that, look for a trained and specialized doctor. And also we are very happy to help you and to give a good consultation for you. It was a pleasure, and thank you for your time, and bye-bye.